Hey Sarah, welcome to the show.
Hi, thank you.
So Releaseology, you're a doctor of physical therapy, but I also know that you do so much work with like the nervous system. Could you just share a little bit about your journey and what brought you to, the space you're in now where you're helping patients with like chronic pain and things like that?
Yeah, so kind of a crazy journey. I always have specialized in essentially brain injury, stroke, so anything really involving the brain. So I kind of always laughed when I decided to start my business. Uh, I thought I was going to completely go away from brains, but ironically, many of the techniques I specialize in actually are just now pain, and from the brain standpoint. So I just love the brain, and I feel like we don't give it nearly as much credit as for just how if given the right tools, I think it's just magical what the brain can do.
Absolutely. So you help people heal chronic pain, but it's sort of a different approach. Instead of prescriptions, things like that, you really work with the nervous system. So, how did you discover this kind of in your professional journey?
So I've actually had the technique we'll talk about it later. Neurokinetic therapy, NKT. I've had it done on myself. So I kind of knew it was there in the background, but it just meant more to me when I got certified in it. And it's literally looking at our brain and body is very good at compensating. I always say like our body will always prioritize energy efficiency, so it's going to, why use one or five muscles when you can use one, which is great from a survival standpoint, but the brain's also not smart enough to know that automation can have undue effects in the future, or like when you do need that muscle to work, now your brain almost has a harder time accessing it because you haven't used it in years.
Okay. So, like, if you were going to explain releaseology to a friend over coffee, like, how would you describe it? Because it sounds to me like it's kind of like a new way to heal, kind of moving beyond symptom management. So, like, how would you explain releaseology to them?
Yeah, so I just say that I look essentially at how your brain and your body programmed your brain and body to react. So our brain is very smart at oh, I've had the situation happen once before. I'm going to take all this data and anything that's similar to it, I'm going to react that way. Now I have this history of information on how I should react. And because of that, I'm looking in at your nervous system, your eyes, your jaw, diaphragm. My chronic neck pain, I actually didn't know you could be pain free, which is ironic as a physical therapist. So my chronic pain was gone, and it actually was coming from my eye muscle. And why that makes sense, 'cause I'm very good at making sense of things, is it's how my workstation is set up. So I'm constantly looking to the same direction. So right, if I practice use that muscle 8 billion times in one day, I just told my brain that that is a reliable muscle. We are just going to use that one. Why would I spend more energy to use any others? But then again, when I do actually need that muscle to work, then my brain's like, oh, I forgot all about him. So
You mentioned and like neurokinetic therapy, I think it was
mhm.
NKT, and for myself, for listeners who don't know what that is, like how does it differ from physical therapy, and how does it play into like the healing the nervous system?
So neurokinetic therapy and KT can be practiced by more than just a physical therapist. So that's how it differs as well. But it's super effective, super efficient, hands-on technique. For those familiar with applied kinesiology, it uses muscle testing. So it's able to rule out eyes, ligaments, diaphragm, and those muscles in a like very efficient manner. Like basically, I can look at, let's say, even if you had 10 things that possibly could be contributing to your pain, we could look at all 10 and kind of clear that out within one session. And then it basically is program like it finds like for me it finds like which my eye muscle was taking over, right? So it figures out who did your body want to prioritize and then who's not doing its job. And I think that's one of the biggest things is no other technique finds which specific muscle is not working. Whereas like traditional PT really looks at, your knee hurts, let's just strengthen every single muscle that attaches to the knee. Um, which can be effective, but it's usually not effective long term, right? So this is what's great is it's like now working on the brain, we're really promoting that balance of like, hey, stop using this muscle so much. Now we need to use this one, or this one works for you.
So is it like overusage? Is that part of it? That there is like this imbalance, and you're going in and trying to kind of find where that imbalance is and address it?
Yes.
Okay, okay. Because I think when I was on your website, I was reading some of like the posts, and you have great content there, like blogs and things
Thank
like
you.
that. But there was something I call it was like is symptom whispers, and little clues that your body will give, like brain fog or grumpiness, kind of saying that your body might be off. So like is that so? And then, like, did I read that right? And then, like, if so, what are some things that people miss, and how can we start getting in touch with our body and noticing that those are those little whispers?
Yeah, so I call them symptom whispers because essentially like your pain, dysfunction, balance, it all starts with a whisper. And then eventually when it becomes a symptom where you're like, "Oh, I have this back pain," that's now a scream, right? Like that is like your body's like, "Okay, like I've had enough." So I mean, pretty much any sign, because this was surprising for me, any sign of a little bit of gut dysfunction means that your vagus nerve is not doing well. So, your vagus nerve is really what most people are talking about with the nervous system. So, if you ask me if I had gut issues, my answer would always be no, because mine are not as bad as other people's. But really, acid reflux, right? How often do we hear that people have that? Diarrhea, constipation, just irritable bowels, not being able to process the food correctly. Obviously, our food supply, that's a, you can go down a whole nother rabbit hole on that, like the ingredients that we have. But it's just so interesting to me because I had to have my gallbladder removed actually in physical therapy school. And it's like, and I feel like I was kind of younger-ish for that to have that happen. And everyone's like, oh yeah, it's just normal. Like so many people have had it removed. But in all my studying, just the formation of a gallstone, it's because my gut incorrectly assessed how much bile or how much whatever digestive enzymes to make, which then forms the gallstone. So there was already a mismatch that, like, these things, these symptoms that everyone has, I think we often kind of normalize them. But so gut is a big one. Shallow breathing is also a big one. I think that's like a very hot, everyone talks about just take a deep breath. Um, but the shorter and shallower your breath is, the more fight and flight that you're telling your brain that you're. So again, right, like your brain has programmed, it's like, oh, once upon a time, Sarah was breathing really, really shallow, and it's because she was like trying to run from, whatever, an attacker, or like one of my biggest traumas was in a car accident. So you're so most people think that their breath is actually fine because that is their normal breathing capacity. But I am still shocked to this day how many people's ribs and diaphragms I feel that have they're literally stuck to their body. So no matter how many times people coach them to take a deep breath, like especially for myself, I was like, I mean, I'm doing as deep of a breath as I could. It is insane how many symptoms I had that were actually showing me that my diaphragm wasn't doing well, but my oxygen levels were just fine. So nobody really ever looked at those things, or I was kind of an overweight kid, so my brother would always joke that I was just out of shape. But really, I wonder, now knowing what I know, I think I was living in survival mode for such a long time. So breathing and gut issues are kind of a big hint that the nervous system's not doing good.
That's fascinating, and I also want to tap into in a little bit, like the vagus nerve, because that was something that seemed really interesting in terms of like the work you do. But as I'm thinking about symptom whisperers and um, ways that we sort of move or live that might be causing other issues and imbalances, you have helped so many people work through so many issues. I'm wondering if you can maybe share, a client story that stands out in your mind where they were really struggling, and then working with you, they were able to really kind of move beyond, their pain and come to like a better place.
Yeah, I have so many stories, and it's funny, but I always start with this one when people ask me. I think kind of the cool part is actually it was a fail for me. So I always follow up with a first time client, and the feedback after this client's first session was, I made her feel like she got beat up in a back alley. So I was like, ooh. um, so luckily, they are another clinician as well, and so they trusted me enough to come back. And so we kind of deep dove into it more. And this person is very good at, we call it like body scans, just kind of seeing what's happening in their own body. So we were working on a specific accident, but in the past there was significant trauma during labor, both labors, both children, and then it was also bringing up significant childhood traumas as well. And note, I love talking about childhood traumas because I would never say my childhood was traumatic. So same thing with this client. It's not that there was uh, like abuse, physical abuse type of trauma, but there's so much like emotional and mental, or just honestly like saving face, can be what you're experiencing is different than what you're telling your brain, so it can kind of be this mismatch. So we really kind of dove into her with all of this trauma. I don't know, between me and her, and I think that's why I love sharing the story, is because it was really a shared effort. We together were like, okay, I don't actually think her body was in the right space for healing. So then I switched. So I was doing neurokinetic therapy on her, and it was just too much. And we were doing eyes, which eyes hold a lot of memory too, so that can be kind of intense for people. And it's so close to your head or your brain. And so I just literally switched and I only did vagus nerve. And my vagus nerve technique, it feels like a massage to you, but I'm really working on improving the signal of the vagus nerve, all the physical restrictions around it. And like everything, like this is my space. So we turn down the lights. I've got music going that stimulates the vagus nerve. Everything about it is really supposed to be calming. Your phone's off. So we literally just hammered that for, probably actually like a year now. And this client's like a whole nother person. So, and that's what's cool is she told me that the difference between me and any other clinician that does a lot of the other things that I do was that she actually felt safe to heal. Sometimes our body needs even permission to heal because it's holding on to these traumas because it's like, no, like this happened to me when I was really young. I need to remember this stuff so that it doesn't happen again. Right. So, like, the brain's not smart enough to know that, well, now it's time to let go of that. Or, I'm an adult now and I can deal with that a little bit differently. So,
So, I mean, that's an incredible story. And I'm also thinking about feeling safe, because even if I think of something as simple as a massage, if I don't feel very comfortable, I'm not going to relax and have that benefit me. Uh,
hmm.
you're doing something, far more impactful, and also probably, in some cases, it could be where they feel like they're really going to an uncomfortable place, but then find healing on the other end of that. Um, so maybe like a question is, creating a safe space, is it as simple as sort of lighting and music? Do you think it's just sort of like your approach with people? Like, what makes your approach different? And why is having that safe space so important?
I feel like it can be several things. I've always been very good. It's kind of funny because when I started this business, I actually thought I wasn't going to talk about my work with stroke rehab and brain injury rehab, but ironically, that's what made me so good with dealing. I mean, some of these patients I've treated, they shouldn't have walked away from this car accident, or they weren't, technically supposed to even leave the hospital. Um, so I've always been very good at being honest with. I'm never going to tell someone, oh, 100% I can get you better. I'm creating insane results that I could never have anticipated, but I can't promise. I could say I've had 90% success with a million people, but there's still the couple of 10% that I just can't access. So I think, one, the person themselves that's receiving has to feel that this is going to work. When people ask me who I cannot help, it's those who don't think it's going to work. Placebo effect is as much as 40%. So if you don't think it's going to work, it's not going to work. Or like I actually had to tell people, don't send me. People are like, oh, I want to send my dad to you. They'll book their husband with me, and those are honestly my worst sessions, because they are like, I'm forced to be here. Sometimes they're not even the ones paying for it. It's just, they're like, I don't really know what you're doing. And honestly, it's just awkward for everyone. And just a waste of everyone's time. So I feel like safety can be so much more. I think what I do well is I give people the hope that there's potential for healing, and what I found, so neurokinetic therapy, what I love most about it was that it's a pretty quick fix. If you're having pain, maybe 2 to 4 visits at most. That's my average right now. Yeah, so it's a pretty big. It's just crazy. Once you access what the brain is programming, it's so much faster. Because if you haven't touched on the brain, it's just all these habits come into play. So vagus nerve work, what I struggled with when I started was it can take a little longer, but I'm very good on, like, even if you see me virtually, I give people homework to work on. So it's really up to you, like how consistent are you going to be? Like, even on myself, this stuff has been powerful, but I do feel I can kind of know when I'm slipping back into old survival mode. But then I'm not being as good about the exercises, or when my stressors are increased, then I need to increase my exercises as well. So, and that's what's interesting. I think another thing that I do well is I have terrible ADHD, which I just found out in my 40s and in my almost 40s. It doesn't surprise me. There's actually a patient who diagnosed me. Um, and because of that, I mean, it's crazy how much it played into, like, this is why it was always hard for me to lose weight, is because I'm always looking for different stimuli in my food. Like, I get tired of that. So ironically, even for my vagus nerve exercises, I think I have maybe 75 probably ways that you can do your own exercises at home. And so, like, I'll stick to one. I'm like, oh, this is the best one. And then I'm like, I don't really want to do this one anymore. Or I feel like it's not as effective. So that's what's cool, is I actually give people several. So I'm like, listen, you choose, maybe if this is the only one that's going to work for you, that's great, but for me, and I think it depends on the stressor, right? Like, work stress versus family stress, very different. How much stress or what's going on with you at the time. I think one thing I wanted to note too about safety is I actually took off my smartwatch. Um, and this was a very hard thing as a small business owner, because my God, you can't be disconnected. But one of the things I was reading was, our nervous system was built for our ancestors. So, and the stresses that they went through was, I don't know, getting chased by a lion maybe once a month. I don't even know what the frequency was, but so this book I was reading, they're like, our nervous system was never built. I mean, we get hit with stuff every hour, seconds, right? Like,
Constantly.
um, I've got patients asking me to work on their 5-year-old child, which is like the saddest thing to me, because they are being born into this productive society. So it's interesting because there's arguments with the smartwatches with EMFs and whatnot. And I was like, but even just to get that many notifications, even if all of them were good, right? Talk about the emotional roller coaster you're putting yourself on. And it's hard. I'm not a parent, so I always tell parents, like, with caution, you can apply that. However, but even if it's just taking it off for, like, the last couple hours of the night, just to be able to rest and not just be, we're hit with so many things day in and day out. Like, why not control one thing that you can't, you know?
So that makes total sense. And and yeah, I don't think we're always as aware of just how
Hmm.
much we're being inundated, and that it's not normal if compared to human history and our evolution.
Yes.
Um, so I'd like to jump into the vagus nerve because you mentioned it a few times. That was one thing that was very prominent on your site. So for those of us who don't know, like, what is the vagus nerve? Why is it important? How do you work with your patient's vagus nerve?
Okay. So the vagus nerve is the longest nerve in your body. It comes from your brain. So it goes from your brain, it branches to nerves to your jaw, your eyes, your skull, your ears, down the sides of your throat, to the muscles of your airway, down to your heart and lungs, diaphragm, and then literally is like interwoven through every digestive organ, kidneys, and some sex organs as well. So when people ask me, this is like one of my favorites to talk about, because I learned about the vagus nerve in PT school, but I just learned that it was there. Like, it exists. But just from that standpoint alone, so the reason it hits all of those organs is because it has a hand in every single one of those organs, which arguably that's a pretty important nerve already. Um, and then it also makes sense from the vagus nerve is the one that's responsible for putting you in fight or flight, fawn or freeze, and rest and digest. So if I need to, I always say my outrun the lion, like all of those things, right? My brain, my eyes need to dilate. Like all of those organs need to have some type of response, in response to what's happening to me in real time. And then it also is literally the nerve that controls the level of inflammation in your body. So that's a huge, like, everyone's talking about anti-inflammatory stuff, right? Like, so my joke is that I tie every health hack that's out there. Sometimes I have to Google them, but every health hack out there I can almost tie back to the vagus nerve. Creatine's a big one that's created in your gut, which is controlled by the vagus nerve. The GLP-1 stuff that's out there for that's in the Ozempic and Mounjaros and Wegovy's. That is synthesized in your small intestine and liver, possibly. I think there's another organ, but regardless, it's another organ that's controlled by the vagus nerve. So again, I just feel like, we developed as a society, but the nervous system, I was reading this thing about the nervous system is stuck in the DOS like system, like from our old computers. I was like, oh yeah, I mean, eventually I can't use that example anymore.
Nobody will know
Kids
what
are
it
like, what?
means. Yeah.
It was stuck on I don't even know, desktop. I don't know if those are going to be around much longer, but yeah. So so I was basically, and because it's so long, we always know about, like, when we fall asleep on our arm wrong, our arm gets numb, right? But that's because you compressed a motor nerve, where the vagus nerve is mostly sensory. So if we're compressing it all day, we would never feel it, but because of how long it is, we are actually compressing it all day. Societally, we're not so great on it as well. So that it's not able to fully read the levels of inflammation in our body, so then it can't react appropriately. One other thing I like to point out is, because so it either puts you in like survival mode, I need to outrun the lion, or rest, now I can relax. It can't be in both. So if I'm always stuck in survival mode, there are certain processes that it won't do, because it's like, well, I'm too busy, picking up the kids from school, or, making it to work on time. It's like, who cares about cleaning up my spleen? Like, that's not priority. So that's why I argue that most of us are just so stuck in that cycle that I don't really actually think our bodies could ever truly heal, because it's just been ready to, mobilize, essentially.
So you mentioned that there's, dozens and dozens and dozens of exercises or things that people can do to kind of tap into this and kind of help restore it. Maybe, is there one that you could share just as an example, or maybe a test that somebody could do as they're listening to this to know either that their vagus nerve is out of whack, or on the flip side, to maybe move towards restoring to where they can recognize, wow, I feel so different right now?
Yeah, so palming is one of my favorites. It's a very big sensory overload. So when I worked at the hospital, I actually would get into my car before I started driving. I would just do palming. So palming, you just take the palms of your hands and you just place them on your eyelids,
Okay.
and then just kind of just letting that, like if you're laying down, whatever, best to do laying down, but whatever's comfortable, and just kind of letting your body breathe. The hard part is we're so automated that some of us can't even recognize that I'm breathing shallow, or we can't really recognize what's happening in our body. Palming is one of my favorites. Headaches, I mean, it can help with any pain here. And then it's also because our vagus nerve and nervous system is essentially processing all the data that's coming through. So like this helps it, like, okay, let me just take a step back, close a couple of the tabs, um, and then I have a few free exercises on my YouTube channel, but also I have I think you can search it on Spotify. I'm not that good with, but that's on my website too for free. I have a whole playlist. So anything that's 528 hertz is stimulating for the vagus nerve. Or like in my clinic, I have a sound machine that does wave noises, and that frequency is also for the vagus nerve that it likes. So I actually have a friend who works in the hospital, so she'll play that music while she's charting at the end of her day, to help her calm down. So then you're already, you know what I mean? You're already out of your fight or flight mode by the time she gets home. So I mean, there's so many super easy things that you can implement. And that's what I love about it. It's like, I'm always about like, get me the biggest bang for my buck for the cheapest amount of money. So there's a lot of free things that you can do. Gargling, humming, anything that essentially vibrates this part of your throat, because the vagus nerve comes down the sides. So if you're vibrating, you're kind of like gently massaging the vagus nerve there.
So I'm hearing this and I'm thinking about all the people that deal with chronic pain, um, and so many other issues. And one of the things that I seem to come across a lot when I am in social media or in having conversations is that I feel like people struggle because they go to the doctor. The doctor doesn't always, like, I don't know what's going on, or they will write some kind of a prescription that just doesn't necessarily do the trick, or that maybe has some side effects. Um, you've worked with people, I'm assuming, who felt kind of ignored by their doctors. And um, with Releaseology, I'm curious, like, how do you see that as connecting to something that allows them to feel seen and understood again? And do you have any sort of just overall thoughts about how your mode of helping people and healing people sort of blends with like conventional medicine?
Yeah, that's so funny because I always tell people I took the woo woo stuff, but I applied the science and anatomy and physio. Like I merged everything beautifully, because I still need to back it up. It all still needs to make sense science wise. It just sounds crazy because it just never became mainstream, right? So I am honestly, I'm just very good at, and again, it's because of my work with strokes and brain injuries, and um, sometimes I worked with people that, were essentially like overly exacerbating their symptoms as well. So I was always good at asking what if. So like one of my, I'll never forget, and it was way before I opened my business. He was actually one of my first patients ever, and he said to me, what was his symptom? He said, sometime when I'm walking, I feel as if my body is like he could see his own body walking in front of him. And I never forget, because it was a young guy too. And he kind of like stopped his story and he goes, "You think I'm crazy, don't you?" And I was like, "No, no, no, like let's just think about this." So his eyes, which is a huge part of what we what I do, what we do, what we need to do to feel safe. So his eyes were not tracking properly. So I was like, okay, so his eyes were essentially delayed with movement. So essentially, his body was experiencing what was in front of him before his eyes could even process what he was seeing. So what he said actually made sense, right? So he was quite frankly seeing his body in front of him. um and so like and and that's what I love too. I've been very I've just been very um how do I say? Just I'm just so happy with how with what I've been through with this, cuz I all my mentors were basically like you it's insane how much brain power it takes treating people, mostly cuz you have to like sell yourself, and then I'm like I'm doing all these calculations in the background. So it was a good way to test myself, as people say things I'm like, I was like, hold on, let me just think about it. Um so so as far as breakthrough, gosh, I think again, it's there's so many people who specialize, let's say, in gut or muscles, but I blend everything together so that I can tell you essentially like root cause approach, right? Like we everyone talks about root cause, but I'm seeing how the brain and nervous system are responding. That's literally where it starts. Like you can't get more root cause approach than that. But like I had a gentleman, this one was crazy too. They were actually under the care of Mayo Clinic. And so they came to me, and that's what's cool too, is I have the medical background, right? To know like I'm like, yes, it's okay to come to me. I still need you to see the doctor because I can't test your labs. I can do a lot of things, but I can't do that. So they were actually dealing with like almost dangerously elevated blood sugar. Um, and the vagus nerve is responsible for your cortisol levels, and your pancreas. So I was like, well, let's just try this. It's pretty gentle, you know what I mean? Like I wasn't putting him at risk at all. And then he had those things on the arm, the glucose monitors. So we actually scanned it afterwards. So like for weeks he was completely elevated, and I brought him down 30 points after just one session. So that was crazy because I was like laugh. I still have a text from his wife that was like, he's like, well, we trust you more than Mayo, which is a huge compliment. Because and this is the second time I've worked with them that has actually helped them faster. Just because I just look at those things differently. And then if people want me to talk to their doctors, I always kind of, I'm at least able to explain it in those kinds of terms. Whether or not the doctors believe it kind of depends on the doctor. But I'm always willing to, if they need to know that I'm doing something that's not uh, putting their patient at risk, then I'll send them whatever. But that's the thing, is like I know, because I've had to be so careful with, I worked with some of the most stroke patients. You had to be careful. The odds of them having a stroke again when you're rehabbing them are very high. So I always had to be cautious. So I'm good at pushing the limits without putting you at risk, I guess.
Well, so thinking about pushing the limits, right, and risk. I read recently that coffee first thing in the morning um, can be bad because when you first wake, your cortisol levels already rise, and that then pumps. It basically has you producing the equivalent of adrenaline, um, which I also read can impact your blood sugar levels. Um, I would imagine that would have, coffee in the morning may have an impact on the vagus nerve. What's your take on coffee usage, the vagus nerve? Do you do anything to kind of minimize? Is it not a big deal? Do you have any thoughts on that?
Yeah, that's kind of a fun question. I cannot survive without coffee. Which is funny. I'm actually drinking my tea today without caffeine. But it's interesting because that's a very hot topic, right? Like at first it was good for you. Some people say it's bad for you, and pretty trusted people. So truthfully, my thing, and this is why I love my work, is like it all depends on the person. Right? So like there are some people. I did keto for a long time. I was pretty much in the really deep dove into the low carb world, and that's what it is. Some people couldn't lose the rest of their weight because of the caffeine intake. So it does affect some people differently. I never dared to test myself. Um, but interestingly enough, part of my virtual sessions that work on pain, we essentially reassess how you're moving. So I love this approach. Essentially, if the movement gets better, then your body liked it. If the movement gets worse, that means your body did not like it. Right. So I tell somebody else was asking me, oh, if their workouts were actually making them worse. And I was like, there really is no way to test, but why not just test your body before and after? It is crazy apparent. So it's like, you know what I mean? Like, um, that's the best way to know, aside from maybe like a continuous glucose monitor as well. I know there are some websites now that you can get one without insurance. They're still pretty pricey without insurance, but I kind of agree with that too. I think that like the reason I actually was wearing mine for a long time, because I listened to, I think it was a chiropractor, and she's like, it's crazy because she's like, I could literally eat spoonfuls of honey and it never spikes my blood sugar, which is not really how most people would react, like spoonfuls.
Yeah.
But like, and then she's like, but like a spoonful of, it wasn't quite sugar, but something like that. And then like, even for myself, I was always taught that, right, even though rice is gluten free, it still has higher carb content. So that can spike your blood sugar, but like, it literally doesn't affect mine. Which is funny because I was telling a friend, they're like, well, yeah, but like culturally for years my family has eaten rice, so it could also be a ancestry thing. So and that's just so, and honestly, even when I go to eating Filipino food, typically has a lot of sugar in every entree, and surprisingly that was not, I was literally shocked at how much that wasn't affecting me. But again, it's probably because that's what my ancestors have eaten for so long, you know what I mean? But like, if I eat bread or like potatoes is a whole nother story. But I just think everyone's different, you know what I mean? Like, so being able to test those things is huge.
So if someone's feeling, you mentioned earlier about this gentleman you were helping who his eyes would process things more slowly, so he felt like his body was, he was like kind of outside of himself a little bit.
Mhm.
Um, if someone does feel disconnected or sort of numb, you know, what are some ways, like what's one small thing that anybody at home who they're like, oh my gosh, I deal with that, um, can do to like start feeling connected again?
So palming is another great one,
Okay.
for this, for overwhelm as well, just because it kind of decreases the sensory stimuli. But also, and I use this a lot in stroke rehab before I even was doing this stuff. Any like points of contact with the floor, we don't like, we essentially move freely throughout space, right? So like, giving that pressure on our body, um it essentially gives us a feeling of like, oh, I'm actually safe. So one of my favorites is to lay on your stomach and you're literally just rocking your hips back and forth. It's like, one, it mimics like rocking as we were a baby. But interestingly enough, I somebody else taught me that too. I think it's SWAT. I don't know, some type of group of people that go into homes with guns. They are taught when they come out to physically pat themselves down, because if they're shot, they don't feel it because of how they're so heightened, right? So I need to do whatever to survive. So I was like, so it's interesting. So it's kind of like that kind of sensation of feeling that, oh, I'm actually okay. That's a cool one.
I think on your site there was something about, especially with the virtual work you do with people, that breathing is a big part of it. And smell and breathing have this weird connection between, I guess, stress, sleep, mood. Um, and what, like, does that tie into the vagus nerve as well? Like how are those connected in terms of like our mood and things like that?
Yeah, so I feel like loosely connected, but I don't know. To me, it's all our brain programming.
Okay.
But the vagus nerve is a cranial nerve. It's a nerve that stems from your brain, and so is the olfactory, which is for smell. So they're pretty close to one another. So, which means like, even though they aren't responsible directly, they can still have an effect on one another. So smell ties to your limbic system, so that's our emotion, even our survival part of our brain. So that's what makes the smell, honestly, the smell to me was, I can't get over how bad mine is. Because I don't feel like I taste fine. You know what I mean? It didn't bother me in other ways. But it's a very interesting. I mean, I can literally stimulate someone's smell and suddenly their back pain's better. But by stimulating it, we're telling the brain again that it's safe, and so now it doesn't have to be on guard and contracting your tissues as much. So that's why people are getting more range. So that's what I love. I always tell people I'm not afraid to look in places that other clinicians will never even look.
So, microneedling and or sorry,
Dry
dry
needling.
needling, I
Yeah.
think is what you do, and myofascial release. Because as I'm hearing this, it seems like you're just helping people get in touch more with their bodies, sort of cut off some of these like negative loops that keep people in a state of like pain, discomfort, etc. So since you can't work with everybody in person and you help so many people remotely, like how do you incorporate those, or even can you, uh, to help people's bodies heal in ways that other methods don't really like allow that to happen for them?
Yeah, so dry needling can only be in person. Um and there is like a whole like directory of people who are, it's funny because I've been certified for 12 years. So at that time it was kind of hard to find people, and now it's like I don't even, I had my whole spiel ready of how I did describe it. Like now I don't even have to do that anymore. So that, but also but I've worked virtually with other PTs, you know what I mean? So that's what's nice is I pull on all that knowledge. So same thing with like myofascial release. It is a hands-on technique. But I actually worked with a PT like on the whole other side of the US from me, and their husband, who's not a PT, I actually coached him through what to do for the diaphragm and all of those things. So, and I have like, I of course can always make more, but I have like instructional videos where I'm showing it done. I'm doing it to myself, and then I'm like talking over the video with captions on how to do it as well. So that's what's nice. I feel like almost all of the techniques that I do that have to be in person, like NKT neurokinetic therapy, also has to be in person. But they have a large directory as well. So most of those have directories, and then everything else, like vagus nerve work, especially from the way that I do it. I can't refer anyone out. That's why I was like, oh, it's perfect. I can do virtual. So that's what's nice. Any of those in person things, I usually have a referral for you, kind of depending on where you live. But yeah.
Okay. So earlier you'd said that NKT, the neurokinetic therapy, is can pretty quickly help move people into healing. And um, I would think that there's other ways that you work with folks where it might take a little longer, maybe like some vagus nerve work and things like that. But like after somebody works with you and has a big release, are you finding that it's like a permanent thing? Like how does somebody make that shift that they made like stick for good? Do they keep falling through on exercises? Like what does that look like?
Yeah, so again, just very, very dependent. One of the biggest things I try to teach my clients, and it kind of depends on which one. Some people aren't really sure. I know even when they book themselves, they're not sure. But once people buy into what I'm saying to them, honestly, sometimes it's just as you do your exercises, you're just telling your body, like I said, like it's okay to let the spot go. Sometimes I say like it's not serving me anymore. It's safe to let it go. And then yeah, some people need consistency over time. And it really depends on, because the interesting part is how much most people come to me for a current traumatic event or current injury. It's amazing how we end up going back to birth trauma or or whatever. So it really depends on how much people are willing to also give me. Because I always tell people, I mean, I've had so many like emotional releases. Like I network with a lot of counselors because I'm like, listen, I'm very good at listening to people, but I'm not certified to, give any feedback other than that. But it's crazy how much, when once people are like, or like I was massaging, oh, someone else's hip scar. And it like all of this flood of memory came back, like they were in a car accident on the way to get that procedure done. Like it's literally like all of these events that have anything to do with that scar. So that one had like a funky, it didn't, she said it wasn't as powerful as the first one, but I was like, well, yeah, but there's like deep seated stuff, right? That your body, like your brain shoved in the background. So kind of depends. Like I walk people, I basically just walk people through, sometimes even like for this one, like as she was massaging this scar, then I had her saying, I don't even remember what I like, something like, like this is safe, it's time to let go. 'Cause there's a lot of resentment too, because this scar was this procedure was done to prevent from having a full-blown back surgery, and then sure enough ended up having to have two back surgeries. So like there's also that emotional component of like, well, this was basically a waste of procedure. So yeah, it just kind of depends. But I'm honestly, that's what I'm great at walking people through, because essentially, like, I get it. Like, I don't, I've never had a business model where you should come see me for your life. Cause even for myself, like, I want you to get better, and ideally that you don't have to need me anymore, or, you just follow up, when another traumatic event happens, or, when you just like, hurt yourself or something. So it kind of depends. It's not really, I don't really have a set answer for that one.
Okay. No, so there's a book, and I haven't read it, but it basically talks about how we store a lot of trauma, even family trauma for generations in our bodies. And it sounds like you work with people, whether it's physical, whether it's like neural, um, or just like patterns that are making them relive something traumatic, to just sort of cut that and move beyond it, and have the symptoms kind of abate. Um, is that right?
Yes.
Number one, okay.
Yeah.
Um, and then number two, because I love the thought that this isn't something people are stuck with. I think that's one of the challenges, is whether they go to a doctor and they're on a prescription. Now they're on that prescription for the rest of their life, unless they want to have these things come back. Or they might do other modalities, like let's just say massage, but anytime it resurfaces, they have to go back, and so that's a forever thing. Um, if somebody is listening to this and has thought about, well, I have shallow breathing, or I do have some gut issues, um, and they just feel maybe like overwhelmed or stuck or just uncertain, um, from where you sit, like where should people begin if they're starting to kind of say to themselves, some of this resonates with me? Where do you point people to?
I have a lot of stuff. I have like me doing the exercises on YouTube, on my YouTube.
Okay.
And then I have so many, because I agree. I feel like people need to essentially like sample to see if it's going to work for them. And so that's why I have a lot of things that I would give most of my patients available publicly. I do also have like nervous system courses where I take you through essentially the vagus nerve, even more deep dive than we've talked about already, so that you can understand why certain symptoms can be tied. I mean, what did I post the other, like burnout, like all of the triggers, all of these things can be tied back to the vagus nerve and nervous system. And I think that knowledge is so much, there's so much power in knowledge, you know what I mean, whether or not you're actually going to implement any of that. So knowledge one, and then each tier of my courses comes with a certain amount of exercises. The highest tier, you basically get everything that I've ever thought of and can come up with, and in the future. So that's kind of like a big, and then that one's cool because it also comes with, I do like virtual vagus nerve workshops. I don't have any on the books now. But so I walk you through, it's like a fully guided session, where you're just kind of listening to me walk you through stuff. So that's like a good sample too. I think I have some samples on those on YouTube too, or like Instagram, wherever. Instagram I post on most of the time. But yeah, so trying any of those things out. Um, some of the things that I mentioned, like the palming and the music. But that's what's cool, is because like even if I can't get my hands on you, if you're on the other side of the country, I can still walk you through on how that's feeling. Okay, like now I want you to focus on these, and then I give you, most of my homeworks include video because they're just not exercises that anyone's ever done. So then I give you video so that you can reproduce it, right? And then it's like, okay, then you see how those feel. So I just tell people it's always at least worth one. Like you still will walk away with some value from just one session for me.
That's amazing and beautiful that you do that because yeah, I think for somebody who's maybe skeptical, unsure how it works for them, that's such a great resource for them to dip their toe in the water and then maybe have a validation or have an experience and say this, I think the Sarah's onto something.
Yeah.
Thanks as well. Um, I can't believe how much time is flying. Do you have time for like just three more questions
Yeah, I'm good. Yeah.
with me? Okay. Um, so if you could stand on a mountaintop and shout and have everybody, hear and maybe, one thing that kind of, inform them about one thing that how the nervous system affects their pain, what would it be?
Cool. Um, I feel like I think one of the things I want to highlight because it was shocking for me is that scar tissue matters. It affects pain, and your vagus nerve doesn't like it either. And by that, we're not getting rid of it. You just need to massage it. But scar tissue can be overlooked. Ones are like mole removals, piercings. Tattoos can are technically also considered scar tissue. That doesn't mean you have to get rid of that tattoos. I know that's a very polarizing subject. All you have to do is massage them. The type of ink that was used on the tattoo. Um, and the reason why again is because you've experienced this thing, and even though it like wasn't painful or I don't remember, your body still remembered that at one point it had to deal with going through, um whatever procedure. Oh, people like to not bring up procedures or say that like, oh, it was a small scar. I've had people swear up and down that they don't have scars, and then I find one. But it's because, and that's why I'm so passionate about bringing it up, because um, none of us knew how crazy debilitating it can be. Like I had a burn scar actually on my face that you can't even see anymore, but that was somewhat contributing to my neck pain. I just, and that's just so, it's such an easy fix. Like what if we, because all we need to do is tell the body, like, you spent however many months healing this spot and really holding on to it. It's done. Like, we don't need you to do anymore. And also, like, I've even done scar tissue from like a bone, like a fracture, or like, if a muscle tore, like there's still scar tissue that it heals so differently than a non break. So I think so. Scar tissue matters. Is my
Scar tissue matters. What about supplements? Um, I would think as a doctor of physical therapy, there's things like maybe magnesium that are kind of known for calming people down or whatever. Are there any supplements that you tend to encourage for people to use to sort of support their vagus nerve or kind of just help create a safe space in their body to sort of supplement what you're doing with them or to just kind of help them in their everyday lives?
Yeah, so I'll start with I hate talking about supplements. I mean, I talk about them, but I always give caution, because even the safest I think one thing that many clinicians don't mention. My best friend actually has her PhD in microbiology, and she has a research article on this. So she tested raspberry supplements and its effect on, it was chemo or radiation. I can't remember which one. And she was like, I specifically chose raspberry supplements because they sound innocent, right? Like it's raspberries. And sure enough, it has an effect on how effective the chemo or radiation was. So number one thing is if you're ever going to do a supplement, you have to talk to somebody who knows what medications you're on. There's just too many out there for anyone to really know how much they're interacting. Naturopaths are really good at knowing. Like, I literally had my naturopath look at like the supplement I was going to take and then see what I was on. So that's my number one caution with supplements. I love magnesium. I use magnesium lotion all the time. I give away free samples in my clinic. It Our muscles need magnesium to contract and relax. So I've used it to get out of going to the ER once. I thought I was going to have to go. Um, and it's funny because it still puzzles me. The muscle doesn't feel any different, so I don't exactly know how it works aside from like just the magnesium soaks into your muscles and it works fine. So trace minerals is a really clean company that I like to promote. And then L-theanine is one of my favorites to talk about. It is a amino acid, non-habit forming. So it is good for, I gave it to a client. It was actually for their like neurodivergent child, and it's to help with all the like noise. My naturopath actually shared it with me because she's like, sometimes like I work late as well, so sometimes you're still in work mode, so it's really hard for your brain to calm down. So she would actually take it at the clinic and then maybe take one before bedtime as well. I've heard of people taking it with their caffeine so that the caffeine doesn't have like it helps to combat like the jitteriness. So any type of anxiousness, I kind of love L-theanine for. It's great for sleep. I'm very sensitive to any sleep thing, so I can't take it unless it's nighttime or I'm not gonna make it. My husband, who is very, very resistant to almost sleep things, really does like the L-theanine as well. And then it's not like it's not like a Benadryl where you have the like hangover of a sleepy med. So those are the two ones I probably talk about the most. Oh, because L-theanine can also help the vagus nerve too, because it's dampening just how much noise is coming at you. So those are my
That's
two.
great. I'll be going by the supplement store later because
Yeah.
uh, no, that would be awesome because I have a hard time with having my brain shut off, especially after
Yes.
work,
Yeah.
and then it affects my sleep. So that would be really interesting to try out.
Yeah, I mean, with caution, but I have had somebody say it was a doctor too. They're like, I don't want to admit to you how many of these I've taken in one day before like a presentation. So like that's why I'm like, well, it's relatively safe, right? So
Well, no, it's great that it's an amino acid and you're not, it's not something that, yeah,
like synthesized,
um,
yeah, like made up.
exactly.
Like
Well, and so I would think somebody listening to this loves the thought of working with you, especially when in a couple of sessions, a lot of this stuff could start to be released for them. And I think for so many people, it's like an anchor that just weighs people down, and they feel like
mhm.
there's no hope, and they try different things, it doesn't work, and this might really resonate with them. So if somebody wants to get in touch with you, wants to work with you, or learn more about, you're mentioning on your YouTube, how can people connect with you, Sarah?
Yeah, so I'm Releaseology, spell out the full release. So www.releaseology.com. And then because there is another Releaseology, so add the E at the end. And then I'm at Releaseology on everything. Instagram, Facebook, LinkedIn even, and YouTube. But I think I'm most active on Instagram and Facebook.
Love it, love it. Well, thank you so much for spending some time. Thank you for the work you're doing. I was so excited to connect with you. Just the doctor of physical therapy, and then moving kind of beyond that into stuff that really starts to move people away from chronic pain and work through some of the trauma and those things. I just think it's amazing what you do. So thanks so much.
Yeah, thank you so much for having me.
All right, I'll talk to you soon.